turn it over to Michael Barkan for an extension to our Tomboy series focusing on spring sports season ahead.
Over the past several months, CSN has made a mission to highlight the conversation of women in sports. You may remember our Tomboy series that focused on a number of female athletes and other notable names. As spring sports get underway this time of year, we continue that conversation with two special guests here to tell us about some important health information that could impact you or someone you know. Dr. Sommer Hammoud, who was part of our Tomboy Symposium last month at Drexel University, and Dr. John P. Salvo. Great to see you both. As we get into spring sports now and we see the injuries that occur, is there anything different that women athletes need to concern themselves with as opposed to the other sports in fall and winter?
I think when you talk about female athletes versus male athletes, the main injury risk comes with sports like lacrosse, with the knee injuries. So women in general have kind of this more knock-kneed position of their knees, and that really sometimes exaggerates during jumping, landing, decelerating, cutting and pivoting, and that kind of moment in their knee that pushes that knee into a knock-kneed position can cause them to tear their ACL. And so we know that women tear their ACL at a much higher rate as compared to their male counterparts in the exact same sports. So certainly with overuse and repetitive use of the legs in very similar movements, it can weaken some of the muscles or not develop comprehensively all the muscles in your core and your hips in order to help protect your knees.
Dr. Salvo, what's the answer then?
One of the answers is actually some of the ACL prevention programs that have been out for a while, and they're actually very effective. And one of their main goals is landing mechanics. As Sommer was saying, females tend to have a little wider pelvis, so that puts them a little knock-kneed, puts their knee at a disadvantage when they land, and that puts the ACL under stress. So these programs are really aimed at neuromuscular feedback and teaching them the proper landing mechanics and kind of straightening out their knees and decreasing the stress around the ACL.
What other injuries do you see most commonly in spring sports aside from the ACL?
Spring sports, especially with female athletes, the next one's going to be the overuse or the stress fractures, especially with lower extremities. You know, they're coming out of winter sports. Some of this does have to do with sports specialization, but when you get to the spring, you're doing track, you're running outside now instead of running inside. That can change some of the stresses around the knee and around the hip and around the shin. Probably the most common areas to get overuse injuries.
John McEnroe, the tennis great, used to say, when I was a kid, I played all sports. I didn't just play tennis. Would you recommend that? Is a more well-rounded athlete a better athlete for her sport of choice?
So certainly our orthopedic sports medicine community, the physicians and physical therapists and athletic trainers, we do believe that to be true. We think that people who play multiple sports not only get to work different muscle groups, but they have this relative rest period for the muscle groups that they've maybe been using too much. So if, for example, you play softball in the spring and you're using that arm to throw repetitively, you may get some overuse injuries as it relates to that. But then if you switch over and then in the fall go back to basketball or soccer or something like that, you're essentially resting the arm but still developing, you know, a comprehensive strength program.
I like it. Well, give me two sports that are the worst for women. I shouldn't say the worst, where you see more injuries, and two sports that are easiest on the body, or knees, if you like.
Soccer's probably number one for a couple of reasons.
Toughest.
Yeah, because it's a contact sport. It's all lower extremity. And there are so many more young people playing soccer than any other sport in our country, especially in the adolescent ages. And with female athletes, I think soccer's probably number one. Number two, I don't know whether it would be down to basketball or field hockey. They would probably be the next ones, just also because of the frequency of kids playing those sports.
Sommer, aside from chess, what would be?
I think for women's, one of the sports we haven't really highlighted is softball. I think the softball pitcher is unique in that, in baseball we talk about pitch counts showings on the mound. But in softball, there's no such thing, and oftentimes you find the softball pitcher is the only pitcher on her team. So she's pitching all the games. If they've got a tournament, there are multiple games. And whereas the injuries may be less catastrophic for the softball pitcher, it can really result in a lot of pain that can pull them out of the game.
Mm-hmm. Well, we thank you for being here. You look like a couple athletes yourselves, I must say, ready to go. Dr. Sommer Hammoud and Dr. John P. Salvo, thank you. We also mention a free event coming up at Lincoln Financial Field on May 20th. Anyone who attends will have the opportunity to learn more about sports injuries and nutrition. St. Joseph's basketball coach Phil Martelli will be the keynote speaker. Former Eagle Jason Avant will also be there to speak and sign autographs. For more information, you can visit RothmanInstitute.com. That is RothmanInstitute.com.
All right, thank you.